So today we're going to be talking about oppositional defiant disorder and ADHD. Hi, Joy from South Georgia. And I really would like this to be as interactive a session as possible. So if you have questions or particular issues that you're dealing with in your home, please let me know. Hi, Abby. Defiant one from Maryland, over 60, rarely open to guidance, even on a new job. Well, that is very interesting. And defiance can continue through adulthood. It might be how you're wired. So I'm going to get started by talking about what is defiance. Hi, Lynn. Nice to see you. So what is defiance? So defiance is a refusal to obey. It's kind of open resistance. And kids with ADHD and adults with ADHD may have a real reason for their defiance. And defiance also indicates a lack of connection and disempowerment. Hello, Inga. Welcome from Morocco. Oh my goodness. Great to have you. Hi, Heather. So when we are talking about oppositional defiant disorder or defiance in general, we want to think about a few themes. One, that kids are defiant often for a reason. They may feel controlled or disempowered, disrespected, frustrated, or unheard or unseen. So I want you to take a minute and think about what might be contributing to defiance in your child or in yourself. And throw that into the chat. What do you think is contributing to defiance in your child? Or if you can be if you're defiant and always questioning as an adult, what contributes to that for you? Defiant kids often reject a parent or an other adult as their leader or teacher. And defiance shows us that the child feels disconnected from parent, from peers, from themselves. A lack of confidence in their abilities also can contribute to defiance. And the fourth thing that I want to say is that punishment makes defiance worse. We want to use logical consequences with clear limits because that's more effective. Thanks, Heather. Becoming a teenager has led to defiance. There's a developmental aspect of this, that's true. Crystal, my child is ADHD and ODD. Great. So let's talk a little bit about the ADHD-ODD overlap. So oppositional defiant disorder co-occurs with kids with ADHD about 40% of the time. And in the non-ADHD population, it occurs closer to 5% of the time. There's a pattern of extreme disruptive behavior and an angry, irritable mood. Boys with ODD are often more physically aggressive with explosive anger. Girls with ODD often lie, refuse to cooperate, or demonstrate some kind of passive aggression. We have some comments here. Lynn says, I was put into submission in my childhood, obey, had no voice, as submission included getting hit with a red plastic bat, a wiffle bat, for punishment. I'm sorry to hear that. Susanna, difficulty from others to understand what's really happening. Yes. So I did a little research before our session, and I found that there's a meta-analysis which is a research of research, basically, and it found that both ADHD and oppositional defiant disorder and conduct disorder, which are different, and I'll explain those in a minute, can be independently characterized. So we can see in both ADHD and ODD an inability to inhibit the self. And so there will be also slower responses to stop signals. Interestingly, with pure ODD, we don't see that same impairment in motor inhibition. And so it may be that pure ODD can be differentiated from ADHD or ASD by the nature of those inhibition difficulties. Susanna asks, can trauma play a part? Absolutely. Samantha says, is it possible a child who has some level of anxiety and expressive language issues may look defiant or oppositional, yes. And actually, oppositional defiant disorder often is marked by a certain level of anxiety in kids. Does a trauma make a person more defiant? You know, trauma, I wouldn't say necessarily makes a person more defiant, but it will make a person more mistrustful, question things, which could lead to defiance. And various mood disorders also can contribute to ODD. So before we diagnose ODD, we want to rule things out. What do we want to rule out? Anxiety disorders in and of themselves, that the defiance isn't more of a reflection of the anxiety disorder. Depressive disorders, and those would include, you know, dysthymia or major depression, bipolar disorder, and other mental health or physical conditions. We want to have a good evaluation process that's done by probably a physician as well as a psychiatrist. We want to rule out substance abuse because that can increase defiance. Bullying, being the victim of bullying, and trauma. How has trauma impacted the ability to trust other people and interact with them? So we see, we also want to rule out conduct disorder and intermittent explosive disorder. So what are the differences between oppositional defiant disorder, conduct disorder, and intermittent explosive disorder? So we know ODD is characterized by repeated angry outbursts and disobedience and trouble basically following the authority of adults. Conduct disorder may involve cruelty to animals and people. There's a certain level of violence and crime that goes with that. And intermittent explosive disorder is a condition marked by periods of intense, often unprovoked aggression and anger. And so it's hard to differentiate between intermittent explosive disorder and oppositional defiant disorder. So that's why a good evaluation is so important. Let's see what you're saying here. My son is sensitive too, yes. So some of that intense, that defiance could be related to the sensitivity. Chibo says, I have a young niece, age 3, exhibits extreme behaviors from in utero trauma and childhood trauma and foster placement. I have 4 children plus raised 3 foster children to adulthood. This experience is hard. It sure is. And I have to say, you are an angel. How about ruling out autism? Funny you're asking that, Linnell, because I'm exactly going there. So Crystal says, my daughter is so depressed that she really has no consequences that affect her. That sounds really frustrating because when you get that depressed, things don't really matter. So I hope that your daughter is getting treatment for her depression. That's really important. Does fetal alcohol spectrum disorders can present as ADHD plus defiance? They can. And again, that's a great question, Susanna. And we want to really make sure that there is a good evaluation by a medical professional. Is it related to stuffing things and then exploding? Maybe. We might think of that as something else. Association with a narcissistic parent. I'm sure that being raised by a narcissistic parent can contribute to any kind of anger issues, whether it's oppositional defiant disorder or intermittent explosive disorder. What about no outward angry outbursts, but calm, quiet disobedience of boundaries? That might be oppositional defiant, or it could just be exactly what you said, calm, quiet disobedience of boundaries. Sarissa says, I have ODD and my son has ODD. I've learned to use it for my benefit, except I'm lonely. Susanna, can you have multiple diagnoses? Yes. Linnell, thank you. We got a recent diagnosis and I'm overwhelmed about the diagnosis with ADHD, dyslexia, and dyslexia. Okay, so let's talk a little bit about oppositional defiant disorder, and then I'm going to talk a little bit about pathological demand avoidance, which is more related to autism spectrum disorders. So here's the thing. Kids act out. whether they have ADHD, ODD, or not, right? We see symptoms of oppositional defiant disorder. They include regular temper tantrums, excessive arguments with adults, uncooperative, deliberately annoying, mean, provocative, spiteful behavior. It's a pattern of disruptive behavior. Now, we also know that with medication and behavioral treatment that includes the family, symptoms can improve and the diagnosis may go away within 2 years. So some people outgrow ODD and some people do not. Many kids with ADHD with oppositional defiant disorder are showing oppositional characteristics by default. They misbehave not because they're intentionally oppositional, but because they can't control their impulses. Remember, that's what I said early on, that one of the things that we notice about ADHD and coexisting ODD is that difficulty inhibiting impulses, right? Not being able to recognize or respond appropriately to stop signals in relationships, in classrooms, at home. So what is the criteria for an ODD diagnosis? So you have to have at least 4 of the following symptoms present consistently for 6 months or longer. And these would include losing temper, arguing with adults, actively defying or refusing to comply with adults' requests or rules, deliberately annoying people, blaming others for their mistakes or misbehavior, and this is a big one. There's a lot of difficulty among kids with ODD in taking responsibility for themselves and what they're doing. Easily annoyed by others, angry and resentful, and spiteful or vindictive. And these behaviors must be markedly different than in typical children or teens of the same age or adults, and a similar developmental level. And they can't be explained better by another diagnosis or an event, okay? So when we see oppositional defiant disorder, these symptoms will occur more frequently and interfere with learning, school adjustment, and sometimes with interpersonal relationships. And I would say often with interpersonal relationships. When kids have ADHD and ODD, they have strained relationships with parents, siblings, and peers, other students. There's a negative impact on their school performance. There's a higher risk of low self-esteem and depression. And parent behavior training is the key to coping with and reducing oppositional defiant disorder. We also see a real denial of responsibility. Let me just go to see some of the comments and then I'll continue on. Does medication help with impulse control issues? It seems to help with focus, but not impulsivity. You know, that depends on your particular child's response to the medication. Ideally, we would love it if medication did help with impulse control. That would be something to talk about with your provider. Sometimes for kids who have ODD, they work well with what's called polytherapy. So they may take a stimulant and a non-stimulant, which helps them manage their ADHD, the emotional side of ADHD when the stimulant wears off. Stacy says, my grandson gets so angry, uncontrollably at times. He says a lot of bad words to me. I try not to let it get to me, but sometimes it's really hard. You bet it's really hard to put on your Teflon suit in these situations. Kim, my son was diagnosed with ADHD and ODD in 3rd grade. He's a junior in high school now. He is very sensitive and can cry very easily. He can also become angry easily. He has never been aggressive with us, but will throw things, break things, or hit objects when frustrated. So I'm very glad to hear that he hasn't been aggressive with you, Kim. He needs tools for how to manage his anger and his frustration, and we're going to get to that in a minute. ODD can happen anywhere. It can be at home or at school or at work. brushing teeth and bathing is an issue, right? Because you're trying to control their bodies and they don't want to be controlled. They don't want to follow rules that you're setting. So this can be a real issue at home. Okay, so let's go back to a couple more sort of facts and descriptors about ADHD and ODD together. Often these kids have tantrums due to an inability to control their impulses or their temper. They can be spiteful, upset others on purpose, and blame others for their own mistakes. If they're overly excited or they're hurting a classroom while playing, they might lash out and blame the classmate and then refuse to apologize. Now, conduct disorder is something different. Now, where oppositional defiance disorder occurs 40% of the time for kids with ADHD, conduct disorders occur more like 14% of the time. And this is a more serious level of misbehavior. Lying, persistent lying, stealing, destroying property, aggression toward people or animals, serious violations of rules such as running away from home or truancy, burning things, hurting animals. So these are the kinds of symptoms we see in conduct disorder, which absolutely requires treatment, just like ODD. It's just a different type of treatment. Behavioral, of course, interventions work for conduct disorder, and medication can be helpful. Yes, ODD can be just at home and not at school, because kids may be able to manage their frustration at school, but then only act it out at home. And thank you, Annie, for putting that article up. When you're looking for counseling, it should involve both your child and you, to focus on ways to cope with these inappropriate behaviors. Parent management training, in which you learn to change how you're reacting to your child's behavior, is very effective. And treatment for ODD and ADHD often involve a combination of individual and family therapy. So I wanted to just say a few things about how do we tackle defiance. So one of the ways we tackle defiance, before we go into how-tos, is we want to consider health and safety concerns first and foremost, always. I want you as parents to reflect on your approach and manage your own reactivity. We're going to brainstorm ideas with our kids without judgment or grimaces. We're going to set up a fallback plan. So this is what we're going to do when things escalate. And if that doesn't work, we're going to do this. And we're going to expect to renegotiate and alter programs as part of trial and error learning. Now, I said earlier I would say something about pathological demand avoidance, which is different than ODD or conduct disorder. This is part of the autism spectrum disorders. It's characterized by the overwhelming need to avoid or resist a demand that's being placed, or the feeling that there's a demand being placed on you. So when we're working with kids who have pathological demand avoidance, also called PDA, and I know there's lots of letters going around here, we want to allow kids the option to say no and give them a choice. This is also true for kids with ODD. That's very helpful. With PDA, we want to avoid using demand words, use inclusive language, and to take a teamwork approach. How would it be if we blah, blah, blah? Could we start blah, blah, blah? And you want to do a lot of appreciation of the efforts that they're making. Now, here are some strategies for dealing with lying, avoidance, and pushback that we see in ODD. Before I get to that, Julie asks, does ADHD, ODD ever get better with age? Yes, it often can. So you know that I'm all about the 5 C's of ADHD parenting, and I have put together a little handout for y'all. Just got to find it on my notes. Here we go. And this is about apologies of action. So check this out. And hopefully that will be useful to you in your family. It's a free downloadable when you go to my website. So, so when we're talking about strategies, we want to think about the 5 C's. So let's review what those are. Self-control. You, the parent, you have to control yourself in these situations, because the minute that you get off your center, your kids are going to continue to provoke you, and you're not going to be able to be the kind of parent you want. So take a quick break if you need to. Go to the bathroom. Everybody knows people have to go to the bathroom. Wash your hands. Splash some water on your face. Say something encouraging. Take a little break to pull yourself together. Compassion. This means we're going to understand that our kids actually would prefer not to have conflict with us. They would prefer to feel connected, to trust things, to have life be easier. They're struggling. And you're struggling. So compassion also needs to go to you. Self-compassion. You and your child are doing the best you can with the resources you have available to you at any given moment. Sometimes when things heat up in moments, you don't have a lot of resources available. Please go to my website and check out the Stop, Think, Act information, or on YouTube. It's very helpful for what to do when things start to escalate. Collaboration. This means you're going to work together for a plan towards improving one issue that you are struggling with. And you're going to be consistent, not perfect, okay? You're going to try to do something as much as possible, and you're going to notice their efforts and with excitement. Okay, and finally, celebration. You're going to encourage and validate any progress towards working on one of these issues. The progress is as important as the achievement of the goal. Sarissa says, I think the ODD PDA crossover is when PDA needs the needs the inclusion words like "we can do," and then ODD is like you didn't do your part, and then you're angry. Okay, I think that's really interesting. Thank you. Marissa, what is the best type of therapy for a 5-year-old with ODD? My son is in art therapy for ADHD, and this helpful ? So I think art therapy can be great for self-expression and alternative options for self-expression. And the thing that I think is important, though, is that you are doing some family work, or you're getting some parent coaching on how to manage when your son is activated and making choices you wish he weren't, so that you have more resources, because you are mostly around with your child. You know, you're the one who's with them more than anyone else. Sarissa, I had sepsis, and the brain inflammation, triggered my ODD behavior as an adult worse than when I was a kid. Oh, that's terrible. I'm so sorry to hear that. That sounds awful. Okay, so now we want to think about adolescence. Someone said adolescence has triggered ODD behavior. So we know that preteens in particular experiment with defiance because they hear suggestions from their peers, because they're naturally testing limits. It's like I always said when my daughter was growing up, or my son, it's like I had a big red button on my chest that they would push when they were just to get me going. And I was a good Energizer bunny, and I got going. And now as an adult, I'm trying to be different. The effect of puberty on the brain is significant, and we can't basically, minimize that. We'll see that will affect kids' irritability, their mood, lower their frustration levels. Kids need a chance to correct themselves. And what I would suggest is that you consider instituting in your family a take back of the day. Everybody gets one, a chance to basically take back something they said that was inappropriate, mean, hurtful, unhelpful, and that's it. They get forgiveness for that, and that can be very helpful. Let's see. Does ODD include laughing? Yep. A lot of this describes our daughter, and one of the things we find the hardest is when she smiles or laughs after defiant or spiteful behavior. How can we cope with this? Ignore it. The smiling is a coping mechanism. It's probably opposite of how she feels inside, but she can't actually show you how she feels inside because she's ashamed. So she's going to smile or laugh to try to sort of slough it off. I would ignore the laughter and just deal with the behavior and what's happening. Jennifer, my 18-year-old says he's an adult and no longer has to listen to his parents. If your 18-year-old lives on his own, in his own apartment, paying his own rent, buying his own food, paying for his health insurance, and supporting himself, he probably doesn't have to listen to you. But I would imagine that your 18-year-old lives in your house. And if your 18-year-old is living in your house, then you need to sit down and negotiate house rules. And this is very important for kids with ODD and also kids with PDA. You have to work with them to figure out what are acceptable ways of being in the family and what are some ways that are unacceptable, and what are the logical consequences when those happen. Dawn says, I've done this with my 9-year-old boy and it's worked. Got a lovely call from his teacher who said how he's so kind and caring with his peers. Amazing how calm and happy he is at home too. Yes. Carrie, this is a great book. It's written by Ross Greene. And he's amazing, and he's like the king. He's done so much incredible work in terms of explosive children, and Lives in the Balance is an incredible resource. Thank you for sharing it. Let's see. Okay, you shared a whole lot of stuff. Awesome. Is there a connection between ADHD and ODD and secondary daytime enuresis? Also, can we treat ADHD and ODD when stimulants cause tics? So to answer the second question first, you can talk to your prescriber about non-stimulants, and that can be useful. Sometimes some prescribers might consider an SSRI, Prozac, Zoloft, Celexa, Lexapro, etc., to deal with the anger, because the anger might be actually lying on top of a bunch of sadness or depression. And I don't know if there's a connection between ADHD and secondary daytime enuresis. So I can't answer that question adequately, and I don't want to speculate and be wrong. Sorry about that. Thank you, Chibo. You're welcome, Alana. Kristen, curious about secondary daytime enuresis. Have you tried non-stimulant medications? Yes, work much better for a minor in my family and myself. So non-stimulant medications actually can be very helpful with enuresis. Thank you for bringing that up, Kristen, and worth trying. Can I explain corroboration in the 5C? Yeah, one of my favorite topics. So the way it works in collaboration is that you and your child sit down. And you can say, I wish things were going a little differently in the family. And your child will be like, yeah, me too. And then you ask your child, what are some things that you think are maybe going well? What are some things that are not going so well? And you write them down. And then you yourself say, well, here, I also think that's going well. And I also think these aren't going so well. Then you brainstorm some ideas. Well, which of these things that aren't going well would you like to work on first? So you get their buy-in immediately because you're going to choose what they think is important. And what they think is important might be you. I want you to stop yelling at me, Mom. I want you to do things differently. And you can say, I think that that's connected to this behavior that I see in you. And so you bring them together and you're doing a double intervention because everybody has some skin in the game. So then you brainstorm some ideas. How could we do this differently? You discuss logical consequences when what you agree on isn't working. And then you come back once a week and you talk about it. So we want them to have skin in the game. The key to a successful collaboration, it may very well be for kids with ADHD and ODD, and I think it's true most of the time, using incentives that matter to them. You know, helping them get points or earn something when they're exhibiting the behavior that you're trying to develop. Might be extra screen time. You know, if they make it through a day and there's no cursing at you, then the next day maybe they can have 15 minutes of extra screen time. So talk about that with them. I had one family I worked with. There were 2 high school boys and a 5th grader. And the parents basically said, your cursing is setting a terrible example. So every time you curse, you get a warning. The second time you curse, I'm taking your phone for the day, because I don't want this example for he was actually in 4th grade, your 4th grade brother. That was motivating for these kids. So we want to think about what's motivating. Marissa, my parents have a hard time understanding ODD. Back when we were young, they said a spanking, yes, would have been something that would have been effective. I told them over and over how this will just make him more defiant, and am I correct? Yes. A spanking only teaches kids to be afraid of you. It doesn't give them tools. Kids with ODD need tools, okay? So we want to think about their executive functioning strengths and weaknesses, okay? Those are the tools we want to focus on. Maureen asks, what do you do? What if you do the collaborative process, agree, and then don't follow through at all? The adult child does not follow through. So when you do the collaborative process, you have to make, you know, some consequences built in. If I don't follow through, I agree X. And if I don't follow through and I don't do my X agreement, this is what's going to happen. When you have an adult child or an 18-year-old who thinks they're an adult living with you, there's a certain level of entitlement because they're an adult. And remember that most of what people live with are privileges. And if someone is living in your home and you're providing them anything other than health, healthcare, food, safety, love, and education in some parts, then that is all to be negotiated. And I think that's really important. Where can we find classes for executive functioning? Well, that's a great question, Leah. I offer classes, but I'm sure Attitude has a bazillion webinars. In fact, I know Attitude has a bazillion webinars on executive functioning skills. And I will be offering classes again in the fall. So we want to think about their executive functioning strengths and their challenges, and then talk with them about it, because we want to link the executive functioning challenges to the ADHD and ODD overlap. This would be very helpful because we're working on a particular behavior, not a character assassination. One of the mistakes we make is we say, you're always this, and you do this, and blah, blah, blah. We're labeling instead of saying, I notice this, it's very hard for you not to blurt out things that you're thinking about. That's natural for people with ADHD. And sometimes the things you blurt out are really cruel and mean. And that's also can occur for people who struggle with some of the behaviors you do. I don't like to give kids a label on, thank you so much, Annie, for posting that. That's great. I don't want to give kids a label, oh, like you have oppositional defiant disorder. How is that going to feel to a kid? It's going to feel terrible. So I just say you're strong-willed, you have a lot of opinions, you can, get carried away with your emotions. You could ask them if they have a name for that, but when we call it ODD, it's already hard enough to accept how it is to have ADHD, and now I'm going to have something else. So really think about that. Thank you, Annie, for posting those executive functioning things. That's fantastic. You want to rehearse, practice, and review all the strategies that you're using for that one new skill over and over again. Practice makes progress. Heather says, mean what you say, say what you mean, but don't say it mean. Really great. whatever scaffolding you create to deal with some of these inappropriate behaviors and the ADHD has to stay in place longer than you think it does for it to work. You want to work with their desire for mastery and control, not against it. Part of the reason they're defiant is because they feel out of control. Okay, so we want to work with that. Let's see, Samantha, child bargains about everything. Homework, time to shower, sleep, meals, even consequences. Is that coming from ADHD or ODD? How to manage? I almost need an immediate cause and effect for the 12-year-old to see it. So first of all, 12-year-olds, whether they have ADHD or not, will argue about a lot of things because that's part of what 12-year-olds do. And 12-year-olds who have ADHD, I don't know if your child has an ODD diagnosis, but kids with ADHD are feisty. They can be really feisty, and that doesn't mean that they have ODD. I want to go back to what the symptoms of oppositional defiant are. And remember that we need 4 of these symptoms that persist for 6 months or longer to merit this diagnosis, and that these behaviors are markedly different from typical children or teens of the same age. Losing your temper, arguing excessively with adults, actively defying or refusing to comply with adult requests or rules, deliberately annoying people, blaming others for their mistakes, easily annoyed and strongly annoyed. It's not just I'm annoyed, it's like I flip the switch. Angry and resentful, spiteful or vindictive. Okay. Let's see. Andrea, I'd say after listening to this, my 14-year-old son may be on the PDA spectrum. He is destructive, cruel, lies continuously, steals within our home. He is totally out of control and has taken a physical toll on me. I now have a heart condition. Oh my goodness. Suffered a broken hand, among other things, but the worst is the impact on his 6-year-old sister. I've tried incentives which haven't worked. I would give anything to get through this. Is there a website with more information on PDA? So first of all, Andrea, I really want to encourage you to take your child to their primary care provider, the medical provider, and get a referral for someone who understands autism and PDA. Also talk about, I don't know if your child takes any kind of medication, but to discuss that as well. It's not okay that you have a heart condition and that there's some, it sounds like, tormenting of his sister. Kristen, I was that kid, still am, but if you explained it to me, I understood it and lessened the ODD side and relaxed the ADHD curious side. What a great point, Kristen. We want to enhance curiosity because when we enhance curiosity, guess what? We enhance cooperation. So helping kids understand what they're doing is so important, and why we're doing it rather than just telling them they need to do this. We want to explain why it's important. Okay, let's see. Renee. Our almost 7-year-old son and us were in behavior therapy for 18 months. He was diagnosed with ADHD and tested negative for autism at a testing center. We and his therapist still have suspicion of autism. How can we tell the difference between ODD and autism, and where is the best place for additional testing? Our son is very oppositional and does not easily accept any answer if it is not in his favor. I don't know if it is rumination and if he cannot understand or process, or he's being oppositional. Also, we've had a hard time transitioning into summer. Obviously, routines have changed. He did excellent while in school. Hold on a second. Now that we are home and together every day, he is ruthless to his 5-year-old sister. I have given rewards for good behavior and consequences for bad behavior, but I feel like every day is constantly breaking up fights, which are 90% initiated by our son. He thinks everything is unfair and nothing is his fault, and that no one likes him, despite our best intentions when calm. How can we boost his self-esteem without also justifying his behavior toward his sister? Well, this is a very complicated situation. So I gave you the part 1, which is to, in terms of actually, I didn't give you the part one, sorry. You know, he may not test for autism yet, and I don't know who's assessing him. So, you know, I think if you can find an autism expert for an older child, I would encourage you to do that. So one of the things about ODD is one of the exclusionary points is that it's not toward a sibling. You know, he's very young, he's 7. And so I would spend a lot of time in celebration with him, like noticing what he's doing well and when he's doing it, and incentivizing him to make different choices. Okay, Kristen. My son says he's always bored after all offering different activities. So, you know, I would encourage you to put up a list on the refrigerator of activities, because what happens is he's coming to you. You're saying, well, you could try this, or you could try that, or you could try this. And he's coming to you. He's like, yeah, no, I don't want to do that. No, I don't want to do that. No, I don't want to do that. Because what does he want to do? He wants to do screens. So I would put up a list and really set some clear limits around screens and what happens before screens. Like, what's the have to that's connected to using the screens? And if he's bored, you know, what are some alternatives that make sense to him that he would like to do? And be sure you post that list so you can refer to the list. Doubtfully, the two usually present together, yes. Part of it sounds like my son. Possible hidden anxiety equals controlling equals rigid. My son is 12. Yes. So one of the things that is clear about ODD is that there is a certain level of anxiety that's connected to it. And that's really interesting. So we want to be able to offer tools for managing anxiety, because what the controlling and rigid behavior is: I'm not flexible. I'm afraid of change. I don't know if I can handle the change. I don't know what the tools I need are for the change that's coming. So it's important that we start to work with the anxiety. What would happen if I try this? Let me see if I can try this and see what happens. It's an experiment. Present together. I've never heard that. My daughter's therapist has never suggested ODD, even though my wife and I have asked. Okay. Again, it's something to ask about, and the therapist may or may not see that, and there may be other things going on. Kristen, my child melts down about anything and everything. These meltdowns result in crying, kicking, screaming, throwing her body on the ground. She's almost 8 years old and has an ADHD diagnosis. We've talked to her about the need to recognize when her volcano is about to blow to help stop it before it starts, but she has a hard time seeing the need to simmer the meltdowns. How can I help her see the importance of learning to control her meltdowns, to even be able to introduce tools? And how can I help her navigate her emotions? I'd love resources. Annie will put up some resources for you, but in order to recognize the volcano, we have to pay attention to the signs that are occurring inside of us. You know, your voice gets louder, your face may get hot, you may sort of have shortness of breath or a knot in your stomach. That's a sign. And then what we want to do is have a very clear flow chart. When you feel this in your body, you need to do this. And you continue to refer her to that. And, you know, for those of you who have artistic kids, draw it, use pictures. The importance of controlling her meltdowns is she probably feels bad afterwards. And that's what you want to work on, because we want her to feel better about herself. And no one feels good after you lose it. It's just not a pleasant feeling. So the idea is that, you know, if you can manage your feelings a little bit more successfully, more effectively, then you'll feel better about yourself, right? Because you're not going to have to deal with the shame, the regret, the guilt that comes with having blown up and said and done things that you regret. So we want to start with identifying what's going on and having specific options for when things are escalating. Again, I refer you to the Stop, Think, Act information in my book, What Your ADHD Child Wishes You Knew, and in your website. You're welcome, Andrea. Okay, so in terms of oppositional defiant disorder, I think one of the leading experts is Russell Barkley, and he has written a book, and I think he has a workbook on this. I would highly encourage you to get that. I'm sorry they call your kid the Volcano. That's terrible, and I would ask them to come up with something else. Biofeedback can be helpful. I think that's a great way for kids to sort of learn to notice when they're kind of veering off, and it's fun because they're games. Those are great things. You could do them in the therapy, or possibly see if there's a home version. Again, I want to share my downloadable with you, which is how to teach apologies of action, which will build accountability in your kids. So thank you very much for joining me today on this summer day. It's been wonderful to be here, and I know these are hard things to talk about, and I hope that you'll walk away from this session feeling like you're not alone, because you're not. You can see how many people are struggling with this, and there's a lot of great resources on attitude for you. Check out my website. Please like me on Facebook. I'm posting things all the time about living with ADHD that are helpful. And you might want to go to my YouTube channel where you can see me live in action. Many of those are from these Facebook Lives. We will be away for the next 2 weeks and back in July. See you then. Take care of yourself and have a great weekend. Bye.